Ladies and gentlemen, our event is about to begin. Lenny Liebman, go ahead.
Hey, thanks so much and welcome everybody to today's webinar on how to cure your mobile healthcare strategy with unified endpoint management, sponsored by IBM and brought to you by eWeek. Again, I'm Lenny Liebman. Glad to be your moderator today. Just want to tell you about a couple of things. First of all, the slides will advance for you automatically. You can also look at the resource button there. If you want to download a copy of these slides, you're certainly welcome to do so. This is an interactive platform, so if you have questions at any time, if one of our speakers says something you want them to elaborate on or makes an assertion you would like to challenge, please feel free to click on that Q&A button and go ahead and enter a question, and we'll get to that after our two presentations. You can also use that Q&A if you have any technical issues. Go ahead and put it in there as a question, and our tech staff will get to you and give you a hand. So with those logistics out of the way, again, just want to welcome you to today's webinar on unified endpoint management as it relates to the healthcare business. Obviously, this is extremely important given the fact that healthcare delivery is increasingly digital, increasingly mobile, involves an increasingly fluid set of players, including not only clinicians and administrators, but even patients themselves. So we've got a variety of challenges when it comes to both ensuring that the right people get the right services at the right time, but also doing so in a way that's secure and fully compliant. So you have two great speakers you're going to hear from today. First up is going to be Howard Cohen, who if you attend our events you're already familiar with. I love his title. He's Senior Resultant with Tech Channel Partners Results Group. And Howard obviously has a wealth of experience, especially on these issues of sort of endpoint infrastructure, virtualization, and all the vendors who are involved with delivering that, whether, again, it's the people who own the mobile device or the people who own the applications and cloud-based services that we're trying to deliver. And after Howard shares, you're going to hear from Jason Prelak, who's Enterprise Account Exec with IBM. And Jason's also got a wealth of experience, not only with technology, but specifically in healthcare. As a matter of fact, if I'm not mistaken, Jason, I think you got your BS in human physiology, but you can talk about that later maybe when you make your prezo. So you got two presenters who have a lot of experience, again, both in the technology of endpoint management generically, but also in the specific challenges we have within healthcare. So I'm looking forward to hearing what they both have to say. Again, if you have any questions, please feel free to put them in Q&A. And Howard, I'm going to invite you to kick off.
Thank you, Lenny. Hello, everybody, and thank you for joining us on today's ESEM. My job in this presentation is to answer the magical question, isn't mobile healthcare an oxymoron? I mean, how can you have mobile in healthcare? And let me kind of jump into that by beginning with the end in mind. Priority one in everything we're going to talk about today is to deliver superior healthcare. At the end of the day, whatever we do, the end result has got to be better healthcare. And quite frankly, a lot of what we're going to talk about has become necessary to deliver superior healthcare today. Let me tell you what I'm talking about. First of all, let's dispel a misconception. There is a popular misconception that you cannot use mobile devices in healthcare because of HIPAA. HIPAA forbids that. And nothing could be further from the truth. I mean, the answer to that statement is really in the name HIPAA. It's the Health Insurance Portability and Accountability Act. That means we have to be able to make the information that health insurance requires portable. We have to be able to move it from place to place. For example, from hospital to healthcare provider in the field. And more healthcare providers are getting out into the field. When they're treating a patient, they need to know about that patient. They need to know their physiology, their history. They need to know what they're allergic to. If that information isn't available to them, they can make mistakes. And those mistakes can have perilous outcomes. So portability is crucial. HIPAA is there not to prevent mobile devices, but rather to enable the healthcare industry to make information available where it's needed. The other proviso that balances that off, of course, is that whoever is making that information portable has also got to maintain accountability. They've got to make sure that they do so in a responsible manner so that private information about patients is not compromised. And nobody really wants their personal healthcare information shared with anybody. And so when we move it from place to place, we have to make sure we're doing so in a very secure fashion. A little bit of further proof, so we've removed HIPAA from being the prevent, and HIPAA is going to be the enabler. To offer a little further proof, we'll go back to 2012. It's 5 years ago. The then National Coordinator for Health IT, Farzad Mostashari, had a mobile device roundtable. In this roundtable, the discussion was, how do we enable healthcare providers to use mobile devices in a secure, compliant fashion to guarantee that the data does not go where it's not supposed to, but only goes from where it is to an authorized, qualified provider. At the Federal Health IT Strategic Plan meeting, the Mobile Device Roundtable, Dr. Mostashari made some interesting statements, and this one I think is most to the point. He was saying that the use of mobile devices is skyrocketing. And if you remember 2012, the hockey stick wave was still cruising. It still is today. One of the most interesting things about this is that, like many disruptive innovations, it starts on one side of the market, in this case, in the consumer side of the market, and then it takes over the higher side of the market, in this case, medicine. Dr. Mostashari refers to medicine as one of the most conservative bastions for the adoption of technology, but he does so with good reason, because in many cases, as we just said a moment ago, the stakes can be life and death. Can't get that information where it needs to be, we can find ourselves in a world of trouble. And so the outcome of this meeting, or the series of meetings, was a document called HIPAA Security Guidance. And this document continues to be used today, continues to be updated. But some of the things that they said were that all covered entities are required to be in compliance with the HIPAA security rule. That's the fundamental of just about everything that HIPAA addresses. That means that you have to constantly stay updated. You have to constantly make sure that your provisions are not only in place, but they're actually working. You have to be able to document testing and full functionality. It's particularly true for organizations that allow remote access to PHI, patient health information, through portable devices. So immediately we start talking about endpoints. Back then, by the way, electronic patient healthcare information was the phrase. The E eventually kind of fell away, and we today refer to it as PHI. In this document, the security guidelines, they identify, and if you look at this list is a whole bunch of endpoints: desktops, laptops, personal computers, personal digital assistants, smartphones, stations in hotels, libraries, other public places, airports, for example, and all of the connecting devices that enable them, such as wireless access points. So very clearly, the folks at Health and Human Services recognized that the endpoints were going to be the most vulnerable part of the overall system, the part where we'd have to pay the most attention to making sure that we were preventing unauthorized access. They talked about risk analysis, risk management, and they talked about establishing policies and procedures. Now, when we start to talk about policies and procedures, we're immediately talking about what is considered to be the least consistent part of any network. It's that segment that exists between the keyboard and the back of the chair. It's a user. People are by far the least reliable, least predictable, least consistent component of any network, because people have freedom of choice. Digital devices, not so much. So immediately they started talking about policies and procedures that people would have to learn and adopt. And then they talked about security awareness and training on those policies and procedures because they realized this is the most vulnerable area. You have a user with a mobile device in their hand. There are many, many ways in which that device can be exploited. What I'd like to do now is kind of frame this in the answer to the question why. Why are we so sensitive about heightened security, full compliance, trained users? What's the emergency? And to answer that, here are some statistics. Everybody loves to see the statistics. Well, here's one. Half of doctors use tablets in their professional life, not to watch movies and read books, but to actually deliver health care, to deliver patient services. 3/4 of them use their smartphones to do that. So in a community where half are using tablets, 3/4 are using smartphones, clearly we've graduated beyond the desktop, beyond the laptop computer, and we are talking about the full scope, the full variety of devices, including medical devices, that are also endpoints. In a survey conducted by Health Information Technology Infrastructure, of the 77% of organizations that don't have unified endpoint management in place, they just don't have it, 42%, almost half of them, said that their IT departments are spending a lot of time manually troubleshooting device management issues. And in that survey, they estimated that those organizations are overspending by about $100,000 a year, simply because they don't have any kind of automated, unified endpoint management system in place. As far as the desirability of exploiting a healthcare organization, healthcare info sells for 10 to 20 times as much as just simple financial info. These thieves want to know your healthcare information because they can get a premium price selling it to somebody for a wide variety of reasons. So in total, just Medicare fraud alone, forget all of the rest of it. Medicare fraud cost $6 billion over the 2-year period between 2015 and 2016. $6 billion. Now, with all the conversations that are going on in our government today about what to do about Medicare, a $6 billion hurt is substantial. The cost continues to grow. A data breach, the cost of an average data breach rose from $3.8 million in 2015 to $4 million in 2016. $200,000 is not a minimal amount. It's not an insignificant amount. And this, according to the Pony Minor Institute and IBM. They also found that the cost per record is increasing from $154 to $158. So multiply that $4 by the number of records accessed, and you see that we're continuing to lose more ground. We're continuing to lose more value as these exploits occur. We then take a look at the security scorecard. This is an organization who annually goes out and looks at a wide variety of industries and how they're performing in terms of security and also in terms of regulatory compliance. Their most recent study in 2016 discovered that over 75% of the entire healthcare industry has been infected with malware over the last year. 3/4 has been infected with malware. The problem is widespread. 88% of all healthcare manufacturers, people who manufacture diagnostic equipment, have had malware infections. 96% of all ransomware affecting the healthcare industry targeted medical treatment centers. Ransomware has become one of the most prolific kinds of exploits in the marketplace today because it directly attacks the human, the user. It's called human engineering. They create a message, that invites you to get great value by clicking on a link. You click on that link, and you're now in a world of trouble. They basically encrypt your data or steal your data and then offer to make it whole again, bring it back to you again, for a significant amount of money. That's why it's called ransomware. This is also widespread across the healthcare industry. Among all the industries that Security Scorecard evaluates, healthcare is the 5th highest in ransomware. The thieves, the bad actors, know that people are most sensitive about their healthcare information, and that healthcare organizations are obviously most sensitive about their healthcare information because they needed to treat patients. They needed to take care of people. So they're much more likely to pay the ransom. And in fact, there are multiple stories of huge ransoms that have been paid. In terms of social engineering overall, healthcare ranks 15th out of 18 amongst industries that were evaluated. And according to PricewaterhouseCoopers Health Research Institute, healthcare was one of the, cybersecurity was one of the top 5 health industry issues in 2016. Of all the issues that confront the healthcare industry, cybersecurity is way up there. It's something we all need to be sensitive to. 40% of consumers would abandon their healthcare organization if they discovered that it had been hacked. 50% would avoid or be afraid of using a medical device if they found out that that manufacturer had been hacked. And we just saw a moment ago how many of them have been. So this trickles down to the consumers themselves, who are starting to have great fear about engaging with healthcare organizations and healthcare manufacturers. Finding out that these things are happening has not really stemmed the tide. When they came back a year later after the 2015 report and looked at companies that had already been breached, they found that they had 2.5 times as many C-scores or lower in their social engineering evaluation. That means things had gotten 2.5 times worse than they were when they were first evaluated to have problems. People are not paying attention. And 40% of those companies that had been breached still had a C or lower in overall network security. In fact, over half the industry scored a C or lower in network security. 63% had a C or lower in patching kit. They don't get the patches. When software and security patches come out, they're supposed to be evaluated and applied promptly. 2/3 are not doing that. Okay. Overall, 38% consider medical devices to be at high risk. 1/3 of the people surveyed for the security scorecard think medical devices as endpoints are at high risk. 2/3 think it's email. 45% talk about their desktop computers, more endpoints. 23%, a quarter of them, feel that external facing and internal apps, the software itself, are sources of breaches. 56% talk about phishing, spear phishing. This is ransomware and phishing attacks. 1/3 still see the threats resting inside the organization, not coming from outside. 16% of impactful breaches are traced to third parties, external organizations that interface with their healthcare organizations. And what are the risks? I'm going to just bring this all up at one time. Some of the risks are very obvious. Okay? Mobile devices are required today for healthcare. Most doctors, most healthcare providers in the field depend upon mobile devices to obtain the information they need to serve a patient, to take care of a patient. But they're also the most vulnerable to any kind of exploit. An endpoint out in the field on a wireless network, we naturally assume it to be more vulnerable than the core network. Patient healthcare information can easily be used in medical insurance fraud, and we've seen $6 billion in Medicare fraud alone. PHI is better information to use for identity theft than just financial information. You know a lot more about the individual when you've got their medical information. On the flip side, in the compliance side, which we really haven't talked about much, the fines are growing and enforcement is growing at the same time. Now fines range above $50,000 per incident, per offense, and individuals can be pursued, not just organizations. So the vulnerability is yours. It falls to the people who are running these systems and operating these systems to worry that they are indeed secure, that they are indeed compliant. And by the way, compliance does not equal security. Just because you're compliant doesn't necessarily mean you're fully secure, and vice versa. Just because you're fully secure doesn't mean that you've checked all the boxes to being fully compliant. So be sure to maintain focus on both, each one individually and separately. The most crucial risk is the unavailability of patient healthcare information to a provider in the field. If somebody corrupts or otherwise makes patient healthcare information unavailable, if a doctor treating a patient at an accident, for example, cannot get at their information to find out what he needs to know or what she needs to know, this can delay care, it can deteriorate the quality of the care, and it can lead to complications or even death. People have died because of a lack of information. So this is not small, and I'm sure that most of you sitting in the audience today are very much aware of this. I really just wanted to bring it all front of mind so that we recognize the context that Jared's going to be talking in. I'm sorry, Jason's going to be talking in. The challenge is the same as it always is in a mobile environment of any kind. It's the same in healthcare. On the one side, you have users. The users want their mobile devices to be easy to operate. They want to have the consumerized experience. They want it to be just as easy as checking social media or talking to their friends or searching for information. They very much like the idea of using the device of their choice. They want to bring their own device. And then that introduces all new kinds of complexities. They need ready access to the patient health care so they can provide services. They want a consistent, robust user experience. They want it to be easy and quick and convenient as it possibly can be. So users want a quick, easy, almost effortless environment. On the other hand, the organizations they work for are responsible for maintaining strong authentication. They need to know that whoever's signing onto their network and accessing their information is who they say they are. Strong authentication means usually two-factor authentication. Entering a password, which for a lot of mobile users is just the worst thing in the world to have to enter and re-enter passwords. They just don't feel a need to do it. But their organization wants them to, has to have them do it. The organization needs tight network access control. The network has to assure that the device that's logging into it is the device that it says it is and is equipped to properly connect to the device. They need data leakage protection to make sure that outsiders can't access the data stream as it travels from the core network out to the edge where the users are with their mobile devices. Files at rest as well as in transit have to be secure, which means they have to be encrypted. You need powerful encryption because that's the only way to truly prevent somebody who has stolen your information from even being able to use it. And that means strong key protection as well. Somebody loses a device, they want to be able to wipe that device to make sure that no patient healthcare information on the device becomes accessible to the thief who stole the device or the person who finds a lost device. That means separating healthcare information from the user's personal information if they're using their own device, because legally they cannot wipe the user's personal information. So managing this environment is very complex for the healthcare organization and very frustrating for the user unless somebody manages it closely and takes advantage of the automated methods that are available to help you manage it. So now that I've delivered all this bad news, I'd like to introduce Jason Prelak from IBM Security, who's going to talk to you, I love the title, about repealing and replacing your mobile strategy with unified endpoint management. And I guess we have to wonder, Jason, are you coming from this from the left or from the right?
I'm coming in right in the middle. Thank you, Howard. Appreciate that. Thank you, everyone, Thank you, everyone, for joining here today. As it states here, my name is Jason Prelak. I'm with the IBM Security Division, here representing endpoint management and helping organizations enable their endpoints in their environment, and how Mastery 60 specifically is helping enable this in healthcare environments. I've been focused in healthcare for over 10 years now, and so I'm very familiar with how organizations are approaching this issue, and I look forward to talking to you all today. So why unified endpoint management? So unified endpoint management provides a single pane of glass for all organizations to manage all devices under a single pane of glass. So whether it be Android, iOS, Windows devices, BlackBerries, we can manage all devices from one single platform, regardless of their mobile devices, laptops, desktops. There's a transition in the industry to be able to manage all these devices in the same fashion, regardless of what device type you have, all from one single platform. And Mastery 60 provides an ease of use and a great user experience for all end users, for everyone within the healthcare continuum. So how does Mastery 60 specifically address healthcare and mobility concerns? Mastery 60, first of all, is not in line with data. So we don't see your organization's data. We don't touch your data. All we're doing is enabling your existing infrastructure and pushing it out to your mobile endpoint. So your organization itself is HIPAA compliant. And what you need to do is bring that existing infrastructure that you have available within your environment to be able to push that down to your mobile endpoints. And Mastery 60 enables that in an extremely easy to do way through our cloud-based solution. So what exactly does Mastery 60 enabling on your endpoints? So we're able to push any data, any bit of information needed to push it down to your devices, whether it be Wi-Fi, email, VPN settings, SharePoint settings. Applications across any platform in your environment, we're able to push this down to all the devices in your environment, all in, as I said, in a HIPAA compliant fashion. So what are we seeing in the healthcare industry? How are organizations using their mobile devices? How are they enabling their organization to work better, to work smarter? Organizations have many different use cases in their environment, from the corporate-owned devices, which are often shared from between different users of their environment. They have BYOD they have to enable. So how do you get that PHI information down to these mobile endpoints, all in a HIPAA-compliant fashion, and in an easy way for your IT staff they don't get overburdened with everything that they need everything that's asked of them. So they built an infrastructure internally, but how do they get this down to their endpoints? Well, Mastery 60 is able to do that across all different areas. And I'll get a little bit deeper into this. I have a few different use cases that I'll bring to light as I move forward with this presentation. As I've discussed, unified endpoint management. If you ask the analysts in the industry, this is the direction that they're moving towards in terms of how they're analyzing solutions like Mass 360 in the industry. And Mass 360 is at the forefront of this with, as we mentioned, a full unified endpoint management solution. And how are we addressing that? In the upper right-hand corner, we have the full security and analytics that your organization is looking for. We have all the mobile metrics to see how you measure against your industry peers. And additionally, we're bringing in Watson Analytics to also measure what your environment looks like, what applications are on it, how do you drive adoption, how do you make your organization more secure within your organization. Device management on the upper right-hand corner. So as I mentioned, being able to think of all your devices in the same way. So you don't want to think about your laptops in a different way that you think about your mobile devices. IT professionals are looking for one way to manage their device. So they want to push a policy, and regardless of device type, they are able to enable that device with that mobile security. So we're talking about being able to push patches, configurations, MDM APIs across any device type. So regardless of device type in your environment, we can manage it. There is not a device in your environment that we cannot manage. And it's also important to mention, in this unified endpoint management, IoT is the future. And being able to manage all these different devices that are suddenly being brought to IT, saying they have to be enabled in their organization, Mass 360 is able to manage these devices as well. And all of these devices typically have PHI and need a HIPAA-compliant solution, and Mass 360 is able to manage those as well. Identity and access management. So being able to push AD credentials across any application in your enterprise. So regardless of what application you have in your enterprise, we're able to push those authentication credentials down to any app in your environment. A common app portal. This we hear about in the lower left-hand corner. Excuse me. We hear about this every day. There's applications coming down from the Android App Store, the iOS App Store, the Windows App Store. You have enterprise apps that you're building. We're able to manage them all in a single pane of glass down to any endpoint. It just really simplifies the way organizations look at applications and enable these applications across all devices in your environment. And what has that evolution been with Windows 10 specifically? So here I'll show you what the evolution of Windows 10 has looked like. So Windows laptop specifically, so Windows was resistant for mobile device management, enterprise mobility management solutions to be able to manage laptops, desktops. So we have the ability to manage all those endpoints, like the laptops, the Windows 7, Windows 8, but they really enabled and the ability to push full policies down to these devices with these Windows 10 devices. And with that, we've been able to gain this full unified endpoint management solution. So in mid-2010, we enabled the ability to manage Windows 10 devices and push policies. And as you can see, the full evolution of how we can manage these devices, how we can tie into the Windows App Store on these devices. So regardless of any Windows 10 device, we can push down those Windows applications down there to devices. We can push policies, Wi-Fi settings, password settings. We can do it all. And that's including all these new devices that are being brought into the environment on these Windows 10 devices that are IoT enabled and are sitting on the Windows platform. So I wanted to quickly talk about a few use cases. I know many of you won't be organizations of this size, but this just shows the pure scale of Mass 360. Mass 360 is able to scale to small businesses just as easily as we can scale up to large organizations. This one happens to be the size of 60,000 caregivers across a large healthcare system in the Western United States. And so with a small business, they're actually using the same user interface that a large organization use? We just focus, you just don't often need many of the features that your organization would need. So Mass 360, we're able to, and we've enabled with this organization the ability for shared devices across nurses, physicians, and patients across this hospital system. So nurses, for example, they typically shift their care every 12 hours. And how do you shift that device without, changing the credentials on that device, changing what information, easily being able to turn over that device? Well, Mass 360 has the corporate shared settings to be able to easily enable that device. Additionally, often organizations are looking to lock that device into one application, whether it be Epic, Cerner, one healthcare app, or one or two healthcare apps. So it prevents the users, oftentimes on those overnight shifts, from going to information, going to websites that they shouldn't be going to when there's fewer people around. Enabling patient satisfaction. We hear this every day in healthcare. How do we improve healthcare metrics at hospitals and organizations? We're seeing more and more the request to put tablets in the hands of patients. And how can you do that in a HIPAA-compliant fashion? Mass 360 is able to push out different policies and wipe devices as they're turned over between patients. So we've seen devices shifted 12 times over on a single day. And you push different policies based on age range so that you enable that device with the applications based on the ages of those patients. And we've seen a tremendous amount of satisfaction, of course, whether they be in a children's hospital or adult hospital, being able to push different policies depending on the type of user that's touching that device. Researchers and workspace. They also had a use case to enable the laboratories to be able to lock a tablet that had a rugged device and give this device to every lab technician in their organization. And we helped enable that through our kiosk features. And additionally, that kiosk device tied in with the IoT management because that tied back into all their laboratory equipment. So those tablets provide direct connection to all their laboratory equipment in their environment to pull down that data directly and manage it back up into their environment. The other success story I wanted to bring to light here today is a large pharmaceutical company that has over 100,000 employees. The reason they moved forward with Mass 360 was our ability to manage applications and the ease of use of enabling users within their organization. This organization has 4,000 applications in their environment, and they needed to be able to push them out to different groups and ensure that the users who needed specific applications were able to easily get to those applications and get to them in a fashion that is easy to manage, easy to use in their environment. So there's a corporate app store that every user has access to where they can only see the applications they need to access to ensure that they get the applications they need, whether they be from the app store, as I mentioned, or enterprise apps that the organizations are building and pushing out from third parties. They're able to push them out in a single pane of glass on a corporate app store in their environment. So why Mass 360? So Mass 360, as I mentioned previously, is an easy-to-use, easy-to-manage mobile device management solution that is not in line with your data. We don't see your data. We don't touch your data, so you never have to worry about us being a third party being in line with your information. So you never have to be concerned that a third party is interfering with that data and it is not is enforcing essentially non-compliance in your environment. So we're pushing out those email settings. We're pushing that out all in an easy-to-use, compliant solution. And I highly suggest to organizations to test our solution. We have a free trial that we're able to enable for you. Please feel free to reach out, and we'll help enable this trial for you at ibm.com/mass360. Thank you so much, everyone.
Yeah, thank you, Jason, for overview of the solution, and thank you, Howard, for setting a lot of context, including kind of what's at stake here and the fact that a lot of organizations that don't do well continue to chronically not do well for a variety of reasons. Howard, I did want to ask you, though, a couple quick questions. So we get this high-level guidance in terms of what the regulatory mandates are, and Jason is asserting that with his technology you can put you have a mechanism for putting the right policies in place. But how does a frontline endpoint manager actually translate the high-level guidance of what an organization is supposed to do with the rather specific parameters of policies for encryption and access and password and multi-factor authentication or whatever else? How do we connect this guidance to actual pieces of configuration rules or policies in the field?
It's a very good long question with a lot of pieces to the answer. First and foremost, I think it's important to understand that no individual product is HIPAA compliant into and of itself. You can't buy a HIPAA compliant product. Products like Mass360 are designed and engineered to help your organization achieve HIPAA compliance. Okay, so it's your organization that's going to be HIPAA certified, not any given piece of equipment, any given piece of software. That's important to remember. So the answer to the question, how does a frontline manager assure that they're fully HIPAA compliant, I'll again go back to the concept of beginning with the end in mind. The easiest answer to it is prepare for a HIPAA audit. When an auditor comes in to make sure that you are indeed HIPAA compliant, they're going to go through all manner of evaluation of your policies, your procedures, the measures you've put in place, the processes you have in place to make sure that your organization is properly protecting and assuring the privacy of large masses of data. There are, within IBM's organization, IBM can easily connect any healthcare organization with somebody who has expertise in preparing for audit. And that should be one of the first questions you pose as you start talking about Mass360. How does Mass360 help me prepare for my HIPAA audit? And by extension, who can help me by coming in and taking me through what the HIPAA audit will look like? It's kind of like practicing for your road test when you're a teenager. You've got to go out there and drive. You've got to park a car. You've got to do a three-point turn. Well, this is a much more expanded reality, but preparing for the audit is the best way to assure that you're ready for the audit, and the audit is the best way to assure that you are indeed maintaining compliance.
Yep. So it definitely sounds like you're saying it's a collaborative effort where somebody who needs help doing that is either going to need some outside help for a vendor and or collaborate with sort of the internal compliance people. Jason, I wanted to ask you a question about use cases.
Before you do, let me just respond to that. Just respond to that and say that remember that people are a big part of this system. Mm-hmm. We talked about how that's the least predictable link. So anybody who's responsible for compliance is going to need the collaboration and the cooperation of every manager in their environment who manages people. Because those are the people who are going to supervise, those are the people who are going to observe, those are the people who are going to make sure that the people function as well as the technology.
Gotcha. Jason, wanted to ask you a question because you were talking about use cases, and I think you included giving patients access to devices based on age, which I thought was real interesting, and the fact that sometimes devices are shared, so we want different privileges on the device depending on who's using it at any given time. Are you also seeing in the healthcare industry that there's kind of an increasingly sort of an ecosystem of care delivery where we're enlisting whether it's external specialist practices or whether it's places where people can actually go to get, for example, injections instead of coming to the main facility, right? We're increasingly sort of subcontracting that. So does that also relate to the solution you guys are providing in terms of enabling outsiders and contractors to engage with our systems in a secure way?
Yeah, I'm seeing that more and more. Whether that be contracted nurses, whether it be, organizations hiring, contractors that, doctors, healthcare professionals to enable their environment. How do they get the data from their organization onto these end users that are sharing devices between different companies, as they're often working part-time between organizations? How do we enable that across all these different, onto these medical professionals' device? So how do you enable that? And we're able to help answer these questions with our solution.
Great. I have a few more questions here, but in the interest of time, I just think I'm going to ask if there's anything that either of you want to share as a final word. Howard, anything before we wrap up that you want to either emphasize or add to what we've spoken about so far?
Actually, I think the question you asked me brought out the most important point, and that is that as you approach these issues, as you approach maintaining the privacy of your patient's information, as you approach maintaining the security of your network, and of course also the compliance, regulatory compliance, which are, again, can't emphasize enough. They're two very separate issues. Just because you're compliant doesn't mean you're secure. Just because you're secure doesn't mean you're compliant. Both have to be treated separately. But I think the word that is most important to keep in mind is holistic. You have to take a holistic perspective because there's a lot of moving parts. Just for compliance alone, there are a lot of moving parts that involve people, that involve the transition of information. Every time you have a transition, you have an opportunity for error. So you've got to pay close attention to those. This is, the real bottom line answer that I gave to that question, and I think it's the most important thing to say here is make sure you have expert help from people who have done this in other environments before. Because for most people who approach this, the one thing they're lacking most is experience. It may be the first time or second time they've done it. Most people in an organization don't go through this kind of process more than one or two times, whereas people who do this professionally are doing it in lots of environments. They get lots of experience, and that experience can be invaluable. So take a holistic view, consult an expert, look at security, look at compliance separately. That would be my biggest overall advice for our audience.
And Jason, anything else you want to share in closing?
I just once again thank you everyone for listening here today. Please, I'd just like to reiterate. Please consider trying our solution by going to ibm.com/mass360 to get any additional questions answered or test our solution.
Great. Yes, you did mention a free trial there, so we definitely encourage people to do that. Also, please, you're going to get a survey when at the end of this event, so please go ahead and complete that. We really do appreciate your feedback so we can continuously improve the quality of the events we bring to you. Again, download the slide deck if you want to be able to review the material. You're also going to get a link to today's presentation on demand, so maybe you want to share this with somebody else on the compliance side, the security side, the desktop side, the clinical services side. This is clearly an effort that requires the whole organization, as Howard said, to get involved, because it's not just what's in the technology infrastructure, it's also the people who are using it. So think about also how you're going to get attestation for policies from them so that you can show that to a compliance auditor, and just kind of work this into an overall multi-tiered strategy for security, compliance, and also, again, as Howard said, delivery of great clinical services and a great patient experience to the people in your care. So on behalf of Howard and Jason, again, this is Lenny Liebman. Appreciate the time you spent with us, and hope to join you again online as we continue to solve the problems of IT in the enterprise. Have a great day.